And hello everyone. I'm delighted today on AI TV to have our very own head of AI strategy, Cassandra. Cass, tell us a little bit about your role and what it is you do in the AI lab.
Hi everyone, my name is Cassandra, so I'm the head of AI strategy, as Indra said. My role is to really think about the future of what we're going to be doing in the NHS AI lab and what that will look like. So I'm really excited to sort of think about how do we make sure we can use AI technologies, that they're fit for purpose, and also how we can link into the wider digital transformation that's happening both within the healthcare system and also in other areas around AI technologies such as the Office for AI. My role also focuses on international. So what are we doing in the UK? How do we share that learning with our colleagues in other countries? And how do we learn from them as well and sort of build that presence for what we're doing in health and care in the AI space?
Brilliant. And Cass, so we've talked a lot about, how to really develop what we call an ecosystem. The lab's got some really great delivery programs, of which more can be found out on our website. But tell us, why do we feel, particularly at this point in time, it's important for us to develop this strategy? And can you tell us a little bit more about the wider strategy that's happening as well across government in AI?
Yeah, so there's a lot of work happening across government and AI. So we have the UK AI Council released their roadmap, which really sets the direction of where they think the UK should go with use of AI. Within that, it called out the importance of health, called out the great work that's happening in NHS AI Lab, and really pushing that ahead to create a marketplace for AI technologies in healthcare. There's also work happening with UKRI and in BEIS around innovation and the use of emerging technology. And the national AI strategy has been developed by the Office for AI. And I'm quite excited to see what comes out of there around how we can use these technologies across different sectors, and also the commonalities between sectors, specifically around regulation, ethics, and capability of these technologies. So coming back to your original question, Indra, I think it's important for us to think about having a national AI strategy for health and adult social care now. We've got a really good opportunity through the NHS AI Lab to create that ecosystem, but we need to make sure the steps that we're taking now lead towards the future state that we want to have. We need to think about making sure that AI technologies are equitable so people across England can use them, and that we sustain and digitally transform systems to make them capable of taking in these technologies. And alongside this, it's about building that workforce capability, making sure they're effective, making sure they're safe. And I guess the other thing to say is like, we are going to demonstrate the potential of these technologies in the next few years. So let's see what else we can do and where we think the health and care system should be.
Yeah, no, it's terribly important, isn't it? And I think for us, especially in the NHS AI lab, to really kind of push that direction forward, a clear plan, a strategy is really vital. So, Cass, we've got a number of people who love getting involved and want to know a bit more about how they could help. What might you suggest to them, or what's the best way of really involving others who want to be involved?
Absolutely. So one thing I'm really keen through the strategy is to work in the open. I want us to be able to share our learning as we go, to invite your feedback, and to invite pointing us at new resources and things that we should learn. So we're really about collaborating with a wide range of people to deliver this strategy, both to make sure it meets the needs, but also so you feel like you've contributed to it and it's your strategy as well. So you can get involved in the development of the strategy in a number of ways. We'll be posting content and things we learn on the NHSX website, but also through the AI Virtual Hub on Future NHS. So the hub is a collaborative space which is open to all, and we will use this to seek input, ideas, and feedback in the strategy, and also to recruit people who participate in some of our research activities that are informing the strategy development. So please do reach out.
Brilliant. That's really great. Now, I'm a big advocate of really kind of getting others involved. So can you tell me a little bit more about how we're getting others from the more international sector involved in this? I know, for one, you sit on the WHO working group with evaluation, and I do as well sit on a number of working groups. So how is it that you and the team are getting involved more internationally in this space?
Yeah, so we're doing some great work with the WHO IT Focus Group on AI for Health, as you pointed out, around sort of regulation, also around evaluation. So it's really about sharing the learnings we have on evaluation in the UK, excuse me, with that working group. We've also been working with a global digital health partnership. So we released a white paper in December, which looks at the state of policy and regulation for AI based on those countries. So at the moment, my team and I are thinking about how can we engage more with the global digital health partnership and with member countries of, for example, the G7 to learn about their priorities for AI. One of the pieces of work we've done recently as a foundational piece to that is looking at other countries' AI strategies and where they place the emphasis on health and care and how their direction of travel. So again, we're trying to engage with those networks, but also if countries are up for working with us, please do reach out.
Brilliant. Great. Well, it's a really exciting time, I have to say. During the pandemic, we've really seen both the benefits and some of the great models and algorithms that have come out on this particular area with AI. Is there anything else that you think we should be doing, or where do you really hope to be in, say, I don't know, 2 or 3 years' time, let's say?
I hope to be in a place where we're able to work with representatives and trusts across the country. I hope to be in a place where we're thinking about care tech and AI for social care and really bringing all the voices around the table. So we'll see how we go over the next few years.
Yeah, it's going to be a big challenge, isn't it, to get everybody round, but hopefully we'll get there. Well, brilliant, Cass. This has been a wonderfully short, sweet interview. Do you have any final thoughts before we wrap up?
Yeah, I'm really keen for people to engage with this work. So please do join the virtual hub so we can reach out to you and potentially get you as part of our activities. But also feel free to feedback, feel free to critique, to provide thoughts and commentary. This is a dialogue. We're creating this for the AI community in health and care. So we're not going to get it right the first time, and we need you to help us get it right.
Brilliant. That's absolutely right. You know, it's people-powered approach. If we do it together, we hopefully will get somewhere that we all want to be in the next few years.
Absolutely.
Well, thank you so much, Cassandra. It's been really great having you here and really amazing having you on the team leading this piece of work for us. So thank you so much.
Great. Thank you, Indra.